Hello, health enthusiasts, and welcome to Rev Up Health, your go-to podcast for all things wellness. I'm Dr. Mark Hechler.
And I'm Tandi Hechler. Together, we're here to fuel your health journey with the best of functional medicine and holistic well-being.
Each episode will dive deep into topics that matter to your health, bringing you the latest insights, research, and inspiring stories.
So whether you're on a quest for vibrant health or just looking for daily health tips, we've got you covered.
So let's embark on this journey together and transform the way you live.
Hello, and welcome to the Rev Up Health podcast. Today, we're going to be talking about perimenopause. Menopause and perimenopause has been a big topic lately. One of the main reasons for the big push recently is Dr. Mary Claire Haber's new book called The New Menopause. And we're super excited.
Yeah, quite an interesting book. And I mean, we really got the privilege to actually go see and hear her in person to speak to, the public in general about the new menopause book. And it's certainly something that has a lot of attention because the auditorium was packed full.
It was.
And it was really encouraging to see that. And there were actually a few men in the audience. It wasn't just all women.
Other than Dr. Mark, there were a few men in the audience.
But yeah, that was certainly really nice to see that and hear that.
Yeah, I think one of the biggest reasons why this is such an important time for women is that for so long we have been undertreated in the area of perimenopause and menopause.
Just underserved completely.
Yeah.
There's so many symptoms that women have, which literally is a list of more than 70 symptoms of menopause and perimenopause. So it is an extensive list. And, it's certainly something where, women would go to the doctor, go to their counselor or something along that line, to a healthcare provider, and, get the labs drawn and go through the whole rigmarole of hearing, okay, your labs are normal. This is part of perimenopause. You can either deal with it or here's your antidepressant. So it gets frustrating, even on our side of the fence, knowing that there's so many beneficial things that could be done for a female, not only to help control their symptoms, but to help improve or maintain or avoid chronic illnesses and diseases, from anywhere from osteoporosis to heart disease to, diabetes, dementia. So it's quite extensive.
Yes. And I think one of the biggest misconceptions is that people often forget that perimenopause, or not forget, I don't think it's very well educated that perimenopause lasts lots of years. Like, it can start in your 30s and will last until you're menopausal, which is, the end of your cycles.
Yeah.
But
it is a transition period, and this transition period lasts for years. And it can start at a variety of different ages too. It can start in the 30s, but typically in the 40s and 50s for women. But it's certainly something you just have to remember, that it doesn't just all of a sudden you wake up one day and you're menopause. It doesn't happen that way.
Right. And I think the other misconception that a lot of people have is that hot flashes are the symptom. That is the symptom of perimenopause and menopause.
It is very common.
It is one of the symptoms, but it is
exactly
not. I would say that is not probably the first symptom you're going to experience when you start perimenopause. So
it could be something simple as brain fog, or, ringing in your ears is even one of the symptoms of menopause in some circumstances for women. But it's just a variety of simple things, mood changes,
Yeah, there's a laundry list, and the book includes them all and has lots of great questions to get you thinking about your health and areas that you might not have been thinking. I think one of the things that was most surprising to me is frozen shoulder is a symptom. And I have had a frozen shoulder and had no idea that was related to perimenopause.
Right.
And I was very lucky to be able to start treatment of perimenopause very early in my 40s.
Yeah, that's awesome.
Which is becoming more the norm now, but certainly that is new. Yeah. I feel like there's a whole generation of women that missed out.
Right. That's something that's of interest and importance, actually, is that, which is the WHI trial back in 2002 when that came out, that really did quite a disservice from, that information that came out of that was kind of not appropriately presented and kind of interpreted wrong too, to an extent. And so as a result, women and doctors stopped their hormone treatment and stopped taking them. But that's certainly something that is slow to come around, and it's still very early in its infancy, but at least we're on the right path to try to, disprove that a lot of those problems that came out of that were suggested are just simply not true, especially not with the different new forms of the bioidentical hormone replacement. But, essentially when the ovaries stop, there's all kinds of different labs that we can draw and identify those times when, okay, we're getting close to the menopause, we're in perimenopause. And so then there's a lot of different levels of labs that we use sometimes to identify that. But be that as it may, that's certainly one thing that we look at. And
in summary, perimenopause is the time several years leading up to menopause when you actually quit cycling.
Right. You'll have the irregular periods. You may have been regular, now you're starting to space them out a little bit. Now they're becoming, okay, we're skipping some. So when those menstrual cycles become irregular, and then you start having symptoms and mood swings and things like that associate with it, then, and the hot flashes, that's when things start to take off a little bit more. They'd be more consistent. But, with the misdiagnosis, it's not easy to diagnose menopause sometimes truly either. There's always, they suggest that if you haven't had a period for 1 year, well, okay, I had spotting here in July, but does that really count? So that's where it's kind of a culmination of symptoms and history and labs that kind of dictate that. So there's not really necessarily always one thing that pinpoints the onset of perimenopause and menopause.
Yes, but according to diagnosis codes and things of that nature,
right,
the definition of menopause is being 1 year without a cycle.
Right.
Sure. But this is also an invitation to really use your intuition and listen to your body. Mm-hmm. I think that is a big part of this. And I think that has been something, there's some stories in the book and some stories that I've heard other people say about how women have gotten somewhat gaslit as far as their symptoms, like, oh, she's just a whiny woman, or mm-hmm. she just, making you think that these things are just in your head, and mm-hmm. they're not. This is real. And so it's just a reiteration to let this population know that your feelings are real, and what you feel in your body. Like if you're not able to get someone to listen to you, a provider, keep looking for a provider.
Yeah. You got to find somebody out there that will not just say, okay, yeah, you're just either going to deal with it or here's your antidepressant. There's a lot of ways to take care of this, and a lot of ways that are both hormone related as well as non-hormone related ways to improve this. And that's the benefits of what we do and what other functional providers do, functional medicine providers that have the specialty background training in hormone replacement. It's just another tool in our belt, and there's multiple tools in our belt to take care of it for women. So.
Yeah. So the lifestyle changes are extensive. We're putting together a 21-day perimenopause wellness guide that we're going to link in the show notes here. So those are just lifestyle changes that you can do to improve your overall health and wellness, but also related to perimenopause. So lots of things that you can do on your own, experiment with the different things that work for you. And then there is the option for some people are candidates for hormone replacement therapy. And then there's also a wide variety of options as far as that goes.
Right. From the non-hormone standpoint, you've got the diet, exercise, those things are pretty important. And diet's a pretty important thing as far as gut health and GI tract health. So that's also very helpful. But, something reducing stress is also a very important thing to help with women getting through this time of their life. But the hormone, as you alluded to, the hormone options, there's the synthetic versions, which is what most of the old WHI trial information came out of. And then there's the more appropriate stuff, treatments from that standpoint is bioidentical hormone replacement. So it's more identical to what women naturally produce. And so it's better, you get better symptom relief, and it's a safer form of treatment too. It's something a conversation that you and your doctor or your provider will need to have in regards to, what are your risks? What are the risks versus the benefits? There's a blood clots in my family. Is there a history of breast cancer? Do I have a history of breast cancer? Just because you have had breast cancer does not mean you cannot be a candidate for bioidentical hormone replacement.
Yeah, I think
but you have to be very careful with that.
You do. And I think it's important to know that the studies have not really shown that hormones cause cancer.
Right.
Now, you do have to be aware that if you are on hormone therapy, if you're on estradiol and you get cancer, you'll have to come off of that while you're going through treatment of the cancer, because the hormone can increase the rate of growth of the cancer. Right. So it's a very different story than what was originally presented.
Yeah. Not only is it a transition of perimenopause, it's a transition, but it's also a transition in how it's treated. So when you look at it that way.
Yeah. And so then the other piece of hormone replacement therapy is that every type of hormone has several modes of delivery. You can take orally, you can apply topically. There are troches that would be like a sublingual delivery.
Mm-hmm. Mm-hmm. Yeah. And there's a lot of different types of hormone therapy that's out there too. But, for the purpose of this, it's kind of more of an estrogen driven topic, I guess. But yeah, there's a lot of different ways of looking at it.
I mean, I think for menopause is the time when your estrogen really drops off, and then you start needing estrogen replacement. But progesterone is
vitally important,
especially for sleep. So that's something that typically starts very early in perimenopause. It's trouble sleeping and staying asleep, an anxious brain that, I wake up at 2:00 and my brain just won't shut up and I can't go, back to sleep. And progesterone is...
Yeah, when that progesterone level starts to drop and not come back up again, it can create quite a bit of mood issues and inability sleeping.
Yeah. And testosterone, I mean, I think that's another thing that, is part of the picture. And looking at where the testosterone level is, and if...
Right, because testosterone is going to get converted into estrogen. Women make their estrogen through that too. So it's certainly something that can't be forgotten.
And when you hit 30, you start losing muscle. And we know that muscle is so important to live a long, healthy life with a great health span. And...
Right. And, with the effects of estrogen on, the brain, the breast, and the bone, it's, and even cardiovascular improvements. I mean, yes, there are limits when a person gets the most benefit from a cardiovascular standpoint for hormone replacement therapy, but it doesn't mean that they can't still take it. You may be past 10 years from your last menstrual period, and your doctor may say, well, the benefits of that, and they're no longer there. But your brain, your breast, and your bone are very important. Estrogen is one of the more important things that we typically need for bone health, bone production and turnover. So it's, to have strong bones, you really need a good estrogen level. It's vitally important. Breaking bones and fractures when we get older is very, very significant.
Right. And there are actually, we recently at one of the conferences that we went to met a doctor, orthopedic surgeon, who is now solely treating osteoporosis and looking at it through the lens of hormones.
Yeah. Estrogen placement. Yeah. He's a huge fan because he knows the studies. He knows what the studies say. It's not that we need to be scared. We need to be very aware and think, okay, it's not just about treating the symptoms. We're also preventing a lot of chronic illnesses that are down the line, staring you in the face, and you have something to do to avoid that or put it off as long as you possibly can.
Yeah, that is huge. And I think another book that we recently read is Marty McCrary's book, Blind Spots. And there is a whole chapter in there on HRT and how the medical community kind of got it wrong with the WHI trial and
how it happened.
Yeah. It's a great book, and it goes into a lot of other things that in medicine where we just get into, this is the way we've always done it.
Yeah. Cognitive dissonance.
Yes.
That's what he calls it. But yeah, just that idea that, this is the way I was trained in medical school. This is the way I was trained in residency. So this is the way it is. It's no other way. This is the way to do it. And if you have that much blindness going into it and through your practice, then you're not looking for the updates. You're not looking for different options. You're not looking for different avenues to help individuals. So it was really, really enlightening to see that and to understand that you really have to be open-minded and understand that you maybe don't know everything, and we maybe don't know everything. We still don't know everything. There's so many updates that are going to be happening in the next 10 years alone. It's going to be incredible. So it's an ongoing process, and you have to have that hunger. You have to have that curiosity to want to really understand and look for these different ways. But there are options out there for one.
Yeah.
But yeah, I think, our understanding of how hormone replacement therapy can help women going through perimenopause is certainly becoming more noticeable. More change is happening, and we are getting more intelligent as far as medical community as well as the public, and on understanding, what needs to happen to help these things play out. So, but I don't know, anything else that you can think of?
I think that pretty much wraps it up. If you have any questions, please feel free to comment, reach out on social media, on our website.
Yeah.
We'd love to kind of help navigate this. And
just educate yourself, be aware, spread the word, talk to your friends. I mean, if you're a woman going through these symptoms, through these conditions, these feelings, having these problems, you're not alone.
Right.
It's so prevalent. If you sit a group of women in the same age in a room, I guarantee you there's going to be 3/4 of them, 75% of them are going to have the same problems or similar as symptoms related to it. But I think that our understanding of it now is going to help women to be able to have a better quality of life into their ages. And that's encouraging.
It is. It really is. So thanks for tuning in, and we look forward to talking to you next time. Thank you for tuning in to another episode of Rev Up Health. We hope you're leaving with some valuable insights to supercharge your health journey.
Don't forget to follow or subscribe to Rev Up Health wherever you listen to your podcasts. And if you enjoyed today's episode, please leave us a rating and review.
Have a topic you want us to explore? Reach out to us on social media channels. We love hearing from our wellness community.
Until next time, keep thriving, and remember, your journey to health is a journey to a better you.
Stay well, and we'll connect with you again soon. This is Tandi.
And this is Dr. Mark, signing off from Rev Up Health. Take care.
The information provided in this podcast is for educational purposes only and is not intended as medical advice. The content is designed to support, not replace, the relationship that exists between a patient and their healthcare provider. Always consult with a qualified healthcare professional before making any changes to your healthcare regimen, including diet, exercise, or treatment plans. The views and opinions expressed in this podcast are those of the hosts and guests and do not necessarily reflect the official policy or position of Revelation Health and Wellbeing.